My name is Danny. I'm a bladder cancer survivor and a bladder cancer advocate since 2023. And we're going to talk a little bit today about TURBT surgery, or TURBT, transurethral resection of a bladder tumor. And this is a surgery that they use to remove my cancer, non-muscle invasive bladder cancer, is what I had. I had a TA tumor. And here's a diagram that will show you a little bit about the tumors when it comes to bladder cancer. Mine was here at a TA, non-invasive papillary carcinoma. That's exactly what I had. On the outer, or the inner, rather, layer of the bladder. It has not, as you can see, these go around to T1, T2A, T2B, T3. These are when they start to invade or get close to the muscle lining. This is the tumor growth, okay? And at TA, I was isolated to the bladder, which was very good news. Once you get down into this area here, this is when it becomes metastatic, and that's the thing about early prevention when it comes to bladder cancer. You have to get it before it gets to these stages. It appears here, and always consult with your doctor to see exactly, but once it starts to it invades the inner muscle layer. This is the bad area. Invades connective tissue. That's, kind of bad. And then we want to be back here to where the flat carcinoma in SITU, which I recently learned the SITU means that it's located just in the bladder, and if it's metastatic, then it's invasive in the rest of the body. So if you hear the term SITU, that's these early stage cancers. My tumor was about the size of a grape, 2.5 centimeters by 1.7 centimeters by 0.5 centimeters. And it was situated at my urethra where it entered the bladder. There's a tube that comes from your kidneys and empties into the bladder. And my cancer was right there on that hole. My doctor called it unroofing the urethra. And I believe in this case, I was extraordinarily lucky that it hadn't moved into my urethra. I think that's like a whole different game. If the cancer had moved into my urethra on its way to my kidney, then that just, I haven't researched it, but something's really, really going to be bad there. So I personally am very happy that I got to this point. This cancer is really bad. It's really deadly. Early prevention, I can't preach it enough. I have another video out about warning signs. You can also go to beacon.org, BCAN.org, and it has all of the information that you need on bladder cancer, from non-muscle invasive all the way up to removal of the bladder, which is called a radical cystectomy, but we will not discuss that here. So when I had my TURBT, transurethral resection of a bladder tumor, they removed it, they unroofed it from the inside of my bladder, so it's gone. And what I had to have, because of the type of surgery that I had, was something called a double J stent. And I had to keep this in for about 6 to 8 weeks. I can't remember exactly how long, but I know it was pretty close to a few months. This double J, you can see why they might call it a double J stent. It's 2 J's. So it hangs in the kidney, and then it hangs in the bladder. And when he removed my tumor here, when he unroofed it, that's going to swell. And if it swells and it closes off the kidney, the way he spoke when I had this surgery, that was not very good, because the urine would back up in my kidney, and that causes big problems. So double J stent, and he said to return in a few months to see if maybe I possibly needed another one. So I went under again after a few months after my TURBT surgery, and when I woke up, he had removed this and decided that a smaller stent wasn't needed. So he was trying to avoid this opening to my kidney closing, which everything went off without a hitch. I was absolutely fine. had the TURBT surgery. I had the double J stent removal. I was well on my way to healing after that. After the TURBT surgery, I did have, unfortunately, what's called a Foley catheter. And my doctor, when I asked him how long I should keep it in, he said as long as possible. So what this was to do is we've taken care of the kidneys to my bladder with the double J stent. Now we have to be able to urinate. So I have the catheter to pass the things that might, just make everything easier after the surgery. So I kept this thing in as long as I possibly could. And this thing was by far the most uncomfortable part of it. I've had bladder pain and such over those months, but I do hate catheters. And I have had 25 of them while I'm awake. I think I last counted, but I don't really want to count. But this is, most of you might have heard of a catheter, a Foley catheter possibly before, but this bulb here, it keeps it within the bladder. And when I was done, it gets removed. So you'll be asked to come back, and this air bladder will be released. I think they keep saline in it. And then it can be removed, which, oh man, that was just the greatest thing ever. The greatest feeling ever. So when I went through that, you're going to get some blood clots, some blood. This was actually very alarming with me through this catheter. I sometimes I can't buy a clue, and when I saw the first bit of blood, because you get the surgery done, I guess, and then you go, oh, I'm like healed or whatever, and you're actually not. So I did pass blood clots and blood, and that was really about it. You can tell what's straight blood, and some was a little heavier, but once again, always consult your medical professionals. Stay in touch with your doctor, because I got freaked out, and I had to call him a few times and talk to some nurses and stuff, and they reassured me that I was okay. But if you have excessive bleeding, excessive pain, excessive clotting, please make sure you keep an eye. And in my case, even if it's minor, call your doctor. So you can really expect this pain. I would call it abdominal pain. I always stay shy of the word pain when it comes to this, because it's more discomfort. I didn't really have any pain per se, but I did have discomfort in the bladder. I had spasms in the bladder. I had some cramping, and my doctor was able to prescribe me some medication, cramping medication actually. So if you do some reading up on it or talk to your doctor, they could possibly give you something. Or I heard, and don't quote me, that cramping medication for menstrual cramps for women works very well, because I think what my doctor gave me actually was the equivalent of that, and it helped immensely. But my bladder was not happy being messed with, and my doctor actually thought I was kind of crazy because I told him I could feel it. He said, your bladder is dumb, it doesn't feel anything but how to pee. And I tell you, I felt it feels other things other than pee. So you let me know what you feel. So these things, I'm going to just go say, when it comes to what to expect as far as pain, it's mild, okay? Along with the pain is going to come, obviously, the urinary urgency and the urinary frequency. You're going to go more, drink plenty of water to flush it out. I found that actually works real good. When it comes to the clots and the bleeding and stuff, and the scabbing that you're going to run into, when anything heals, you need to keep flushing that out. And I just got extremely used to water. Get used to water. This is really a good way to do it. Don't overdo it, but flush that bladder. But I think when it comes to, it's been over a year, like a year and 2 months since I got my TURBT surgery. And I am just now to the point where I feel very much normal. It only took a few months to heal totally and feel normal. But I really now, I still drink a lot of water, of course. So now it's just, it's something to get used to. I told my nurse last time I was in last week, I said my bladder, she asked me if I had any pain. I said my bladder will probably never be the same again. But no, after a year, no, I do not have any bladder pain. The TURBT went off without a hitch. I went to the doctor after a year to have my first scope a few weeks ago, and I still am cancer free. If you get past this surgery well and heal well, which I hope you will, and I know you will, as long as you take care of yourself, you will hopefully be on your way to some kind of therapy, immunotherapy, when it comes to NMIBC or non-muscle invasive bladder cancer. BCG therapy is the most effective, and it has been for many, many years. I hear that they might be coming out with some new stuff, and we will report on that as it comes out, maybe next year. But I am not sure. Right now, BCG immunotherapy works absolutely the best. It's a inactive tuberculosis vaccine, but I will try to do a video of that pretty soon to go through BCG therapy. I'm currently going through 3 years of it. I'm through my first year, and I am no evidence detected. I'll be in remission after 3 years if I continue to get clear scopes, and then I'll have clear scopes probably once a year for the rest of my life. So, as always, take care of yourself. You can fight this cancer if you detect it early. You can fight it all the way through. There's a lot of different methods, but if you get it early, that's the best way to survive. Spread the word about caregivers and cancer patients with bladder cancer and all different kinds of cancers. They need support in every way humanly possible. Cancer was the single most crazy, life-changing journey I ever had. Look back on my videos and you will see the whole thing. I've been documenting the whole thing on video since it started. So I hope this video finds you in good spirits, and spread the word.